Correctly diagnosing an ectopic pregnancy is very important in order to prevent complications. Today I had a young lady walking to my OPD early morning. Missed her periods, had complained of bleeding PV, but then she was also hypertensive. When we checked her BP was low. She was having fainting attacks. She was feeling giddy. She was feeling very weak. She had stomach pain and she also had a shoulder pain. Now, this is a situation wherein we are very suspicious of a ruptured ectopic. So what is ectopic pregnancy? We all know that in a pregnancy, in a normal pregnancy, the egg gets released from the ovary, it comes into the fallopian tube, and then the sperm gets into the uterus and it fertilizes with this egg in the fallopian tube. Sometimes, if the fallopian tube is unhealthy, then the fertilized egg, that is the embryo, gets stuck and it continues to develop in the fallopian tube. And then it forms an ectopic pregnancy. So an ectopic pregnancy is a pregnancy that is growing outside the uterus. Most commonly it is in the tube, sometimes it can be in the ovary and in various other places. So why is it important for us to diagnose it early? If we are able to diagnose an ectopic pregnancy before it ruptures, then we can treat it medically. But if we diagnose it after it ruptures, like in this case, the patient had come to me, she had already had severe bleeding inside. We immediately had to get a scan done, confirm the diagnosis, and we had to operate her. Thankfully, we moved very fast and we were able to save her life. But then, this is important because in case there's a delay in the diagnosis, a lady can lose a lot of blood and it can be even potentially life-threatening. So remember, if you missed a period, if you're having stomach pain, if you're having shoulder pain, if you're having fainting attacks, giddiness, please go to your doctor immediately.